As numbers rise, the CDC just updated its definition of close contact also. They are saying now that it's if you've been within 6 feet of an infected person for a total of at least 15 minutes in a day. So not just a chunk of 15 minutes. That now includes multiple but brief encounters, 1 to 2 minutes at a time.
This morning, we are glad to be joined live again by Dr. Dana Hawkinson with the University of Kansas Health System to look more into this. Okay, doctor, during the previous kind of thought process, I think most of us said to ourselves, well, I don't spend 15 minutes a day around anyone. Like I just kind of go by someone's desk, but there's no long periods of time that I'm spending with people. This changes the game a little bit, doesn't it? Should people think differently about the way they interact with people?
It does, and I think, the CDC has done a very good job. They have tried to get the information out there to people. It is difficult. This is a pandemic. I think what the people need to understand is it's the concepts. And it's the concepts of, well, I was 6 feet, so I can't get it. That's not the point of the concept. It's the distance. Distance is better. The same thing for this. We have dealt with this time period and what does really account for an exposure. We've been dealing with this with the KU Athletics really since the summer. So it's not a new concept to us. But it's the concept of I'm around somebody who is infected or potentially infected. And whether that's 15 or 10 minutes at one time, or it's a cumulative, because we have to understand that this virus is a very dynamic thing. The spread of the virus is dynamic. It probably takes about 200 viral particles, replication competent viral particles to cause an infection. But again, over what time? So those viral particles don't just get into your nasal passages or your respiratory tract and die. They're there. So if you have a cumulative of acquiring those viral particles when you're around somebody who has COVID-19, that's the main concept here, and that's the main goal. And it is difficult because the literature changes, the guidance changes, and it is very difficult sometimes to understand, but just understand the concept of I'm around somebody who has been infected, and whether it's short bursts of time, and that is what prompted the change, is a case report of prison guards in prison, or it's or it's one long time. It's really that concept of being around somebody who's ill and the chance of acquiring those little bit of viral particles that could cause infection.
Doctor, Election Day is around the corner. We know polling places are taking measures and masks are technically required at the polls, but poll workers can't turn somebody away if they are not wearing a mask because of their right to vote. So if I am going out to vote and you see someone around you not wearing a mask, just what do you recommend, especially now that these adjusted guidelines have come down? How do we handle ourselves around others in this time?
Yeah. That's very dangerous. I was able to vote in person. I had a 30 to 35 minute wait in the line. It really wasn't bad at all. Everybody there was very good wearing masks. There were 2 people who only wear a face shield, which again is not considered adequate for barrier protection. I think their intentions were right. But then again, there are probably those people that you were talking about, Lindsay, that just don't want to wear a mask for one reason or another. And it comes down to individual responsibility. And at this point in the pandemic, although it does get tiresome to really continue to promote, it's not just about you, it's about your fellow citizen. The things that you can do individually to stay protected, I absolutely wear a mask, wear a face shield or eye goggles as eye protection as well. And if you can distance from that person also. Some of the stories that we've seen in the media, there are lines outside. Certainly outside is going to be better than inside. But really try to keep that distance from those other people and wear your mask and your eye protection if you can. Those are the biggest things individually that you can do to protect yourself if there are other people who are not wearing masks in the voting areas.
So maybe if you in general wear a mask, this is time to add a couple of other layers of protection.
Yeah, we've always advocated, especially in travel and air flight and when you're in the airports, for example, wearing the face shield or wearing the goggles. It is one more of the mucous membranes of, you have essentially 3, your eyes, your nose, your mouth. Obviously, your nose, your mouth will be a little bit protected by the face mask. But it also, mostly it's a barrier protection in case you have the disease and don't know it and are spreading it. But then the eyes can be protected by the eye goggles or the face shield as well.
Doctor, thank you so much for joining us.
We'll be back.
Thank you.